think we will have to call the meeting to order. I know it's nice to visit. Sorry to interrupt everyone.
Can't hear you.
Oh, here we are.
Yep.
All right, I have to bring it closer. Sorry to interrupt, but it's after 3, and we will start the Older Adult Advisory Committee, and we'll start with the pledge, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Adriana, can you call the roll, please?
Betty Bishop, Rochelle Fuquay,
Here.
Jennifer Hamill, Nils Omholt,
Here.
Suzanne Ostosh, Vito Pianello,
Here.
Phil Randazzo,
Here.
Marcia Relier,
Here.
Joe Silbernagel, Moira Smith,
Here.
Carol Thompson, Barbara Vansickle,
Here.
Carol Weidenbach,
Here.
Kathy Western, Roy Wilson,
Here.
Carol Weisman.
Here.
That completes the roll.
Thank you, Adriana. I need an adoption or a moving for the agenda. Could someone-
moved.
Support.
Second.
Thank you. Are there any questions about the agenda? Thank you. Are we voting on this? Yeah, you just. Okay, so, all in favor?
Aye.
Are there any nays? Thank you. I need to have a move for the approval of the minutes, please.
So moved.
Thank you. Thank you. Who was that? Carol. Carol Thompson. Thank
Can't
you.
even say Carol W.
I'll
because
go
it's
over.
2 of those.
Is there any discussion about the minutes? Are there yays? How do I vote? Call for a vote? Are all in favor? Are there,
Aye.
all in favor?
Aye.
Are there any nays? Thank you very much. At this time, we will have public participation for anyone who would like to speak on any item in the agenda. There will be a public participation at the end of the meeting for anyone who would like to speak on anything. There is no one coming up to speak, so we will close public participation. At this time, we will go to Katie Wendell, speaking for our AAA 1B, planning and advocacy. Glad to have you.
Am I on already? Oh, I am. Usually red means bad on the microphones in Lansing. If it's red, it's not on. So, all right. Good afternoon, everyone. My name is Katie Wendell. I'm the Director of Planning and Advocacy at the Area Agency on Aging 1B. Happy to see some familiar faces here in this forum from volunteers and people that have worked with our agency for a long time, and then perhaps some of you might be newer to our work as well. So I'll start with a bit of an introduction about Area Agencies on Aging. There are 16 area agencies on aging in the state of Michigan, and we're part of a nationwide network created by the Federal Older Americans Act in 1965. We're charged with planning and coordinating services for older adults, family caregivers, and we have some programs also for adults with disabilities. We receive federal and state funds, and we operate a number of programs that support older adults remaining in their homes and communities. We're all about home and community-based services at the Area Agency on Aging. We also fund a network of community-based providers. So, for example, Meals on Wheels is funded through Area Agencies on Aging. It's a common program people are familiar with. We have a resource center, basically a call center with trained staff that are ready to answer questions about resource needs, provide referrals to community-based services for older adults, and they're really the front door to accessing senior services. So, if you have questions about eligibility for programs, or I know someone who needs a ramp in St. Clair Shores, they can help connect with resources that we fund as well as local community-based. So I encourage you to, reach out to us with any questions, and we can help you and the individuals in the areas that you represent access services. I do want to mention we have a great Connect resource guide. It's like a magazine that's at the printer right now. I'm so sorry I couldn't bring it with me today, but I'll be sure to send you all the link to view that publication that has great articles about senior services, and then also a county by county resource guide in the back. That's really a great tool to have in hand. So that'll be available online, but also there'll be a form on our website that you can fill out, and we'll ship you boxes of them. I know you all are great community leaders that can help get the word out in your community. So we're happy to ship boxes here to the county, or senior centers and libraries are already going to be getting them. But that's one resource that I wanted to mention. I'm here today to talk about our advocacy work. Area agencies on aging are unique because we're charged by the Federal Older Americans Act to advocate on behalf of those we serve. So, they gave us money to provide programs, but they also said we're charged with improving circumstances for those that we're charged to serve, which is a responsibility we take really seriously and something I enjoy doing. As such, we have an advocacy platform that's put together by our advisory council and board of directors, which includes local representation from all of our 6 counties, that outlines our areas of focus for communication with primarily the federal Congress and state legislature, but we do some local work as well. And we also work in concert with those other 16 area agencies I mentioned through our state association. And we put on an event every year called Older Michiganians Day, or Older Michiganians instead of Gander, because the act in Michigan is the Older Michiganians Act. So we say if they change the name of the legislation, we can change the name of our day. But that always comes up, so I'll just head that off. So it's a statewide event. Before the pandemic, it was 1,000 seniors on the Capitol lawn. And last year, we actually did a hybrid event with a smaller number of people on the lawn, but a opportunity to participate virtually statewide, and had more participation than we've ever been able to have before. So this year, on May 17th, we are continuing that hybrid format. So there will be a presence on the Capitol lawn, individuals there shaking hands with legislators, as well as the opportunity to participate online at 11 a.m. Or I suppose you could watch it later too. This is really a grassroots advocacy opportunity where we encourage senior advocates, whether it be older adults or family caregivers or just interested community members, to reach out to their legislators to talk about unmet needs in our communities. So I want to start by issuing a special invitation to this group. If any of you do want to come to Older Michiganians Day in Lansing, we can accommodate probably a handful of you participating if that's something that you're interested in. We aren't putting out big calls to the public for large groups, but especially groups like this that you're geographically representative, right? So you'll represent different parts of the county, and we would love to have you there. So if you're interested, please let me know. And then also, of course, an invitation to participate virtually and send letters and contact your elected officials. So with all of that being said, I'll talk through the core issues of our platform for legislative action. We really characterize this as a senior action week. So we picked 5 issues, so there can be an issue a day for focusing. The first issue that is on this particular platform for action is supporting family caregivers. Family caregivers provide the bulk of long-term support services to older adults in our communities. We simply don't have enough programs to reproduce the effort and extraordinary care provided by loved ones to support older adults remaining in their homes and communities. We have some programs to support family caregivers. At 1B, we have the caregiver coaching program, which Barbara volunteers for, that provides mentorship and ongoing support for family caregivers navigating the complexities of supporting someone's care. We have classes called Powerful Tools for Caregivers that provides education on it's like a 6-week course on how to be a caregiver and what questions you should ask and what you should do. We have in-home care services and respite programs, all again to lighten the load for those family caregivers. But it's not enough with the demand for services we have. So there's a proposal, again, from our statewide association requesting $16.8 million to create caregiver resource centers in the state of Michigan. So this is actually a one-time funding request. So we're encouraging the state to use some of those federal American Rescue Plan dollars to increase our capacity for serving family caregivers specifically. The second plank of the platform is supporting the direct care workforce. We have a massive shortage of direct care workers in the state of Michigan and the country. Michigan is not unique in our struggle to find workers to support individuals in really a variety of care settings. We're focused on the in-home based care, but I think facility-based care is also experiencing the same issue with high turnover, incredibly high turnover, a lot of vacancies in positions. I'm seeing Carol nodding as an expert on your board.
We're going through it right now. It's disheartening. All I can say, it's disheartening.
Yeah, and when we have in-home care programs that are ready to serve someone, our biggest barrier is getting that worker that's available to go into the home and do the work. Direct care workers are underpaid for the work that they're doing. It's technically unskilled work, but we'd really argue it's anything but that. If you're going into someone's home alone, providing assistance with personal care, bathing, eating, dressing, if you're having someone help you with those really intimate tasks, you want them to be well trained and confident in what they're doing. You want them to be empathetic and able to communicate with you. It's difficult to find the right person for that work when you're paying them maybe $14, $15 an hour. And they could maybe go work at the mall or a fast food restaurant for a competitive wage to that. During the pandemic, the legislature recognized the critical nature of this workforce and implemented a series of wage increases focused specifically on direct care workers. So at this point, direct care workers are making $2.35 more than they were March 2020 when the pandemic started. The governor's budget for fiscal year 2024, which begins on October 1st of this year, includes a proposal for an additional $1.50 increase. So it'd be $3.85 total. There's a wage coalition of service providers and other experts in the field that are advocating for a $4 wage increase, and recognizing that even then that might get someone up to $19 an hour. If you look around in our communities, it's a really difficult problem that we're having. But any support we have for those wages, along with opportunities to create a more robust career ladder for direct care professionals to attract people into the field, support individuals with more training, will help us in our goal of increasing access to home and community-based services. Pause for a second, and I guess I'll ask if there's any questions about those first two before I continue on. I'll take a sip of water.
Is the $19, is that including benefits? I see you've got down here increasing wages and benefits.
That'll vary a little bit by their employer, probably, but that would be the hourly take home, I believe, is looking at Carol.
Well, I mean, it's hard, like for me as an independent owner, it's hard to offer benefits. I do have certain programs, certain different programs that they can get into and some connections, but it's hard. I mean, especially because I'm private pay. So for me to pay them that $19 an hour, I have to charge the client an astronomical amount to be able to stay in business for myself.
Yeah, most direct care workers are part-time, so I guess is speaking to benefits, many wouldn't be eligible for benefits from their direct care job, which is especially issue in home care because you're going from house to house, maybe doing 2 hours of help for so-and-so in the morning and then 3 hours in the afternoon. It can be really difficult to compile a full-time caseload, especially, if workers have families and things like that, it's not a traditional 40-hour work week in that setting.
So is that a hindrance to getting people to work?
Absolutely.
Because it's not a full-time?
Absolutely, especially,
Well, nights, weekends, there's where everybody wants that 9 to 5. And then they want 9 to 1 with a 3-hour lunch break or whatever, so it's very hard because you go by the client's schedule of what they need, not what we would prefer.
yeah, if someone needs help dressing every day, that's a morning shift, including weekends. So there's,
They like to get dressed on Sunday too.
yes, absolutely.
Katie, I'm glad you opened that up. Is there anyone else that have questions at this moment?
Yeah,
Roy, go ahead.
Where, do you appeal to a certain group of people?
For requesting
for-
funds,
For care, to help an older person?
so we, at the Area Agency on Aging, we work with a whole network of home care companies to actually provide the care. So we, most home care companies, they become vendors of our agency and they actually employ the direct care worker. And, we create the care plan with our nurses and social workers, and then they pick up the cases. And where we have an issue is that our reimbursement rates are so low, especially through Medicaid programs, that in-home care companies say, I can't pick up your cases, especially if there's a private pay case they could take instead.
Yeah, the profit margin is just not there, it's just basically pass through. By the time you pay someone's taxes, their workman's comp, all that, what they're paying, it doesn't. And I don't know
Not
what the answer is.
necessarily.
Insurance should cover these services, that's what the answer is.
Not necessarily talking about wages, but the Connect magazine, I can't say enough about. It really talk about resources all in one place. And you said that it is coming out?
In the next couple of weeks, it's at the printer right now. Can I go pick up some and take them with me? But it's
No, good to hear.
very close
Very
to
good to hear.
launching.
And actually, I have to say that your agency has almost become a partner with Trinity Lutheran in Utica. They're offering the Powerful Tools class there in August. And that's kind of a unique situation because it's not always offered in the summer. But Janine, God bless her, is willing to do that. And another opportunity for people is they're going to be at the health fair at Trinity as well. So if you really want to meet some of the people and see some of the resources, that's another way to do it. So we really appreciate all that help.
Thank you.
Katie, I had a question for you. In regard to the investing the $16.8 million, I know there's a need for this, obviously. When you said there won't be any more money spent, I find that hard to believe, but I'm not saying you have a problem with that. But it says a caregiver resource model. It doesn't say that it, what did you call this?
Caregiver resource centers.
Centers. All right, so a model is, I don't know why they use the word model here. What does that mean? I mean, what was the word model for?
Yeah, thank you for the comment because I can provide a little bit of clarification. Area agencies on aging receive federal funds that are targeted specifically to family caregivers. So we have to exclusively use them to support caregivers. And so we do that using the powerful tools and things like that. This is a one-time request to increase our capacity to maybe offer a wider variety of programs and services. So there's a lot of startup costs to bringing on additional classes and things like that. And it's based on a model from California. So they have built their area agency on aging system to also be considered caregiver resource centers. It's kind of a brand. So they reference a model because it's mimicking a model from California.
Thank you. And in regard to more pay, I agree that they should be given more pay. They needed more pay years ago when I worked as a nurse. But if you start off with $14 and add $385 you think they're gonna get?
Yeah, these are just estimates.
Estimates, and then they get $4, that's $21.85. I don't know what nurses are getting now, but $21.85 should be good pay.
I think it's lower than that. I might have started a little high.
Anyway, I just thought it was a good pay considering. Yeah, I think and our society's absolutely changing, so it's a real situation. And families a lot of people aren't home, so it isn't 50 years ago. It certainly isn't 100 years ago.
And while family caregivers play an essential role, not all families live as close together as they once did. So, having your adult children nearby might start to become more the exception than the rule, for how aging services are usually provided.
Thank you. Are there any more questions at this time?
There are 3 more issues of the week. I just wanted to pause before
Yes.
throwing 5 issues at you.
What's your support in the legislature for this?
Generally, aging services has quite good support across the aisle. And we're optimistic this year because state revenues are up and there have been some federal investments. We wish the governor's budget had included some of these items. It really just included the direct care worker premium pay, that $1.50 was included, but none of the other items we're talking about were included in that initial budget proposal, which does create a little bit more of an uphill climb to educate so many new legislators. With the redistricting and term limits, there's a lot of new faces in Lansing, so it's hard to get commitments from individuals who have been in office for just a few months. But we have found the legislators to be more knowledgeable about senior services in this term, maybe than they've ever been before. A lot of legislators with personal caregiving experience who had loved ones impacted during the pandemic and nursing facilities and things like that. So there's a lot of interest in senior services. So I've been doing this for like 8 years in Michigan, and I think that this legislature seems to have a lot of personal experience in relation.
Is there data on each legislature, how many seniors there are in their districts?
Yes, but all the district maps changed. So some of the census charts hadn't been updated yet. So I could tell you what the old districts were, and we were waiting for the Census Bureau to update with the new maps. So I need to check back up on that, but around election time, November, that wasn't available yet.
Thank you.
So the next issue, which I'm really excited to talk about, it's actually a newer one on our platform, but I think it's really important and the case is really strong, to support the long-term care ombudsman program. So area agencies on aging are really focused on home. Our one interaction really with licensed long-term care facilities like nursing homes is through the long-term care ombudsman program. Long-term care ombudsmen are advocates for residents of long-term care facilities. They can receive complaints from family members or residents, and they help the residents navigate resident rights, communicating with a facility if there's a concern about the quality of care being provided. The Area Agency on Aging 1B has 3 full-time long-term care ombudsmen to serve our 6-county region, and they fielded over 1,100 complaints last fiscal year. In Michigan, we are lagging behind the rest of the country in the proportion of long-term care ombudsmen we have to the number of long-term care facility beds. I have a one-page overview of this issue that I'll pass around, but the recommended minimum ratio of ombudsmen to facility beds is 1 to 2,000. Michigan's rate right now is 1 to every 5,150 beds. So we are 4th from the bottom in the rank of 50 states as far as our current access to ombudsmen, really. If we got to that 1 to 2,000 ratio, we'd be middle of the pack. It's either 27th or 29th we'd be if we hit that ratio. So that's just to put that number in context, that half of states in the nation are providing that level of ombudsman service right now. What that means in Michigan, we're here if you call us, and our ombudsmen provide excellent service, but they aren't able to be out in the facilities as often as we would like them to do, doing outreach, making sure people are aware of the services they can provide, and connecting with people maybe before there's a big problem. So we have been working with the state long-term care ombudsman to craft a proposal for how we can fix this problem. And to reach that 1 to 2,000 ratio, we would need an additional 33 full-time ombudsmen in the state at a cost of $3 million annually to support that staffing. So that's something we're working on educating the legislature on. It's again an issue that we haven't talked about a lot, and a reason why we are so interested locally, aside from, of course, the really compelling numbers, there's a funding formula for how funding is split between the 16 area agency regions in the state. The regular funding formula is updated every 3 years. There's a separate formula for the ombudsman funding. That formula has not been updated since 1987. I called my predecessor on the phone. I was like, did you ever work on this? Because I couldn't believe it. So Region 1B, we're getting like 16% of the ombudsman funding statewide. We get about 28% of other funds. Since 1987, the population has shifted in Michigan, and our region has grown and grown, while some others have lost population. So we're feeling that problem more acutely here. So in addition to requesting the funds, we're asking that the Michigan Commission on Services to the Aging update that formula to make sure the funds go where they're most needed.
I have had interaction with 2 situations concerning citizens with ombudsman, and one about a year ago and one last week. I went physically into the nursing home to mediate a situation that she had already been in, and I couldn't believe how knowledgeable the one a year ago was. That's from Michigan, from Macomb County and St. Clair County. That woman works. Knowledgeable. I didn't even know all the stats on that. She understood the situation. Just incredible how she would. The whole goal is for the patient. It's not necessarily for the family. It is for the patient. And I wouldn't want to be doing something wrong as a worker and have that woman come and take over. I wouldn't want to be the person. And I was glad to hear that. And the person this last week was out of our county, was trying to get his mother back here. So he was talking to 2 ombudsmen. And so I ended up with communication briefly, because it was just today or yesterday that I was able to get a hold of her, contact her with the state ombudsman. And I said, is the number 33 viable? I assume it is. I assume you were part of this. She said, yes, they're not all part. She said there are a couple part-time. And because that's, if you spread that out, that's $90,000 a person. But there are the cost, because they only make, I think, $55,000 to $69,000. And so I would like to have known where they're spreading them out, because you have more people down here, but you also have people in the other part of the state, which is important. So I assume everything's going to manage out for all of our citizens in the state. And there are a lot of factors with care. We all have family. We all have older family, and even younger family that need care like that. And but I'm glad to see that there's that kind of care for overseeing our citizens that are in facilities.
Thank you for sharing your experience. I've found the ombudsman to always be very impressive in the scope and breadth of their knowledge about long-term care issues. Yes, we worked in partnership with the state ombudsman to create these figures, knowing approximate salary, benefits, and things of that nature. The ombudsmen are hired locally. So the money would go through the state funding formula and be distributed to the 16 regions. I've already testified with the Commission on Services to the Aging how important it is that they update that formula. So I would expect Region 1B to get at least 25% of the overall $3 million, and we would use that to hire locally. So it's not like the 33 positions would be hired by various regions of the state. So in some areas, they do only have a part-time ombudsman. We really want this formula to be updated in conjunction with a funding increase, because no one is overserved right now with ombudsman. It's not like someone is having an exceptional level of service. Everywhere in the state is struggling, so we can't take a part-time ombudsman away from a rural area. We need to kind of lift all boats with this request, and that's really what we're trying to do.
Okay, who is the ombudsman then from Macomb?
Louise Verbeek.
Well,
Louise, Verbeek. Is that,
I think it's Elaine Hearns.
oh, is it Elaine? I'm sorry.
Yeah.
We have three. So we have
Oh.
Louise Verbeek, Elaine Hearns, and Mary Katzrelis are the three for.
can I get those names from you later?
Absolutely, I can email them and they can go out to everybody. Sorry, I got the counties mixed up.
Just had a question. You said you need 33 more. How many are there total in the state? And
There are currently 20 paid program staff.
20 for the state? And what Barbara was just mentioning too, but I divided out in my head here, so it comes out to like 85 to 90,000 apiece. But that's including benefits? So
Yes.
the salary is less than than that?
Yes.
By about a third or 20?
Yeah, we estimated about 55 to create the.
Is that a high enough pay to get quality people?
Well, there's probably gas involved because they travel and maybe there's classes they take and, you know, information that they gather. And I would assume there's an array of cost that goes along with that. I would think.
Yeah, we worked with the state to try to, estimate a reasonable figure. And that was, based on our knowledge of current salaries across the state and things like that. Our region is likely to be a little bit more expensive than some others, but when we do these kinds of requests, we put it forward in a statewide manner.
When you say a ratio of 1 to 2,000 or 5,000, you're talking patients, not facilities, aren't you?
Yes, so technically we talk about facility beds, so it's like kind of the current capacity that's licensed in the state is kind of our best way of estimating. So that is beds in licensed nursing facilities, adult foster care, and home for the aged. They serve all of those licensed facilities.
But the 2,000 is actual number of patients in the facilities, or is that the facilities?
So it's like licensed spaces in the facility. So occupancy varies honestly day by day, people, entering and leaving facilities. But our total capacity is reflected in that. Well, currently it's 1 to 5,150 beds.
So you're talking about beds, not complaints.
Beds, yes.
Beds.
So essentially people, but
Okay.
are we at 100% occupancy all the time? So that's, but that's the standard nationally for how we look at how equipped are we to handle the number of possible individuals. So if we were looking truly at individuals, I'd have to get updated numbers from the state about current occupancy. So that's why I was making the distinction. But we were talking about individual residents, essentially.
Is there any possibilities of ombudsmen that would represent individuals in home care? Also, there's an awful lot of independent living places that are not licensed, and there's complaints for those folks. Are there any representatives or any kind of individuals that could be targeted to speak for those folks?
Great question. So the Michigan Elder Justice Initiative goes by MEJI, MEJI. They house ombudsman programs for the My Health Link program, which is active in Macomb County, as well as the My Choice program. So those are 2 Medicaid-funded home and community-based service programs. So it's a statewide model. We don't have local ombudsmen for those, but those are newer in the last several years that there are ombudsmen offered for those programs. But those are housed in, again, that MEGI organization. I'll pass around, this one pager, but I really think, I guess personally, I'm really excited about this issue. I think that this could have a big impact on quality of life for individuals in nursing homes. And we know coming out of the COVID pandemic how tough things were in nursing facilities. COVID was a terrible condition in a congregate setting. Even in the best of nursing homes, it was really a struggle because it was so contagious and particularly harmful for older adults. So I think there's a lot of interest in supporting this population, which we're excited about, but we also want to make sure people have access to care at home, and that we aren't just, funding nursing homes in a much larger way when we have a lot of need on the home side too. So I think this can bridge a couple of those interests really well too. So thank you all for your questions and interest in that. So then talking about those home care services, those of you who've been on this body for a while have heard me talk before about the Silver Key Coalition. Our tagline is to make Michigan a no wait list state for senior in-home services. Area agencies on aging, again, this federal and state funding, we have funding for in-home services for individuals who do not meet Medicaid income guidelines. Most home care is funded through Medicaid, so you have to meet the requirement being low income. We know individuals who are just above that income threshold, even by a couple of dollars, are sometimes the worst off in our community because they can't afford to pay $40 an hour for an in-home care worker, but they also need some support to stay at home. So we are able to serve some of those individuals through our community living program. Across the state, there is a wait list of over 7,000 individuals waiting for these in-home service programs. We prioritize who gets care based on those who are highest need, so it's not a first come, first serve. We assess someone's income level, the level of support they have, how many ADL, activities of daily living and instrumental activities of daily living they need support with. We serve the highest need individuals first. So you could be on that wait list for years. But we're trying to serve those at greatest risk in this program. But funding is what limits our ability to do this work. So the statewide coalition of providers from across the state is requesting an increase of $9 million in state in-home service funding to help us increase access to the program, along with $1 million to support the Meals on Wheels program. And then the other in-home service program is the My Choice Medicaid Waiver Program. The My Choice program serves individuals who meet Medicaid income guidelines, so you're low income, but also require a nursing facility level of care. So you have pretty high care needs. And again, we serve these individuals in their homes rather than in a nursing home. It costs about 2.5 times less the cost of a Medicaid nursing home bed for a year. It's a really life-changing program for people who are enrolled in the service. There's been some implementation challenges, namely the going into this fiscal year, so October of 2022, the state recommended a 2.5% rate reduction for the My Choice waiver program. We're looking around the world and seeing what costs 2.5% less than it did the year before. The rates are set through an actuarial process that's really dense and difficult to really have it understand the costs of providing care. We have provider agencies asking for double-digit percentage increases in their pay, and the state's coming to us saying that they thought it would cost less. They did eventually change course and do a 0.5% increase, but it's a struggle for us to be able to continuously enroll in this really valuable program. It has a great track record in the state because of some of that support at the state level. So just asking that that option be preserved and maintained, especially as the state explores demonstration programs like the My Health Link program, working more with private integrated care organizations. We really want to make sure that there's a nonprofit option available through the My Choice program. So those are the 5 issues of the Older Michiganians Day platform. Really appreciate your ongoing interest in advocating, in this important time. Older Michiganians Day is in May because right now is when the legislature is setting the budget for the next fiscal year. We expect that to be done mid-June. So it's a great time to reach out to your legislators and talk to them about the needs you see in the community, whether it's something I've listed or something else. We have a letter writing campaign as part of Older Michiganians Day. I believe maybe a link was sent out. If not, I can follow up after. Or people can even just fill out on a Google form, your name and zip code, and we can get that letter to your legislator. Our goal is to go to Older Michiganians Day with a large stack of letters. So while we don't bring 1,000 people to the lawn anymore, we're showing that level of interest through the letter writing campaign. So I'd love it if you were able to share that and sign on individually as well. And we'll make sure those letters get to your representative and your senator, and then everyone on appropriations. We'll print out lots of copies to get those around. Then on an ongoing basis, we have what's called the Advocate newsletter, which is published monthly. It's just can come to your email and gives updates on all of these issues throughout the year. Action alerts when, call your legislator this week to talk about this issue that they're considering. So that's another way to stay engaged with us. These 5 issues are, the focus right now, but I'll pass around the ombudsman sheet as well as the Area Agency on Aging 1B's full legislative platform that outlines even more issues that we're interested in working with the legislature to support.
Are there any questions at this time? Karen?
I got another question here. At this point, on these 5 points you have here, you're asking for about $30 million. How much of what you ask do you get?
Depends
what's
on the
track
year.
record?
The Silver Key Coalition had a really great run. For about 5 years, we got what we asked for. The last couple of years, I think with COVID and not being in front of the legislature as much, that hasn't been as successful. The direct care workforce has been really successful. That $2.35 it's a massive appropriation at the state level. My choice, I'd say maybe 50-50. So I don't have an exact figure. Usually when we look at our legislative platform with many issues, we make progress on 70% probably in a legislative cycle of 2 years. So we're very early right now with this legislature. We have typically at the end of each session, we'll do we've achieved our goal in these areas. These are the ones we made progress, and these are the ones that saw no action. So that's what I'm trying to think of to answer your question. And that's not always dollars. We're very appropriations focused right now because of, I guess, 'tis the season for asking for money in Lansing. But we do work on other issues, penalties for, elder abuse, guardianship reform, things like that once the attention moves away from the budget, some of those become more. So that 75 kind of incorporates that.
I have kind of 2 unrelated questions in a way. One is, because of the COVID emergency situation that's going to end May 11th, I think it is, I've heard that some people that have qualified for Medicaid services because of the emergency will not now qualify. And will that impact people in nursing homes and people who are getting some of the Medicaid dollars?
Absolutely. So during the COVID-19 state of emergency, which is a federal declaration, no one was kicked off of Medicaid because they were no longer eligible. So if someone's income went up a little bit, if what sometimes happens in My Choice is if someone's functional status improves and they no longer meet that nursing facility level of care, those redeterminations, is what we call, weren't happening. So starting May 11th, and throughout the next year, those redeterminations will be happening for everyone. So there will be individuals who no longer qualify for My Choice that are receiving services. For nursing homes, typically once someone qualifies for Medicaid, I think it's less likely you see them regain income or have such a big change in functional status that they would no longer qualify for Medicaid. I'm speaking a little off the cuff there. I'm not sure, what the projected impact is, but we do expect maybe, I think less than 50 out of our almost 900 My Choice clients to be impacted. I think it's a relatively small number. I think it's, not trying to overpromise, but I think it's tens of people, not hundreds in our context. Because generally we're dealing with a pretty high care need in our program. What might happen though too is individuals have to recertify their income in ways they haven't had to do. And this applies to the full Medicaid population. So if you changed your address or just haven't logged into My Bridges in a long time, we will see some individuals perhaps struggling to get the notices in the mail if they've moved. They're really asking the public, let people know who are on Medicaid to update your address so the state you can get the notices you need to get, and that you provide the required documentation on time, just because it's been a long time since that's been asked of people.
And that's kind of hard for a lot of people to do anyway, to keep track of that. It's just mind-blowing in a way. The other part, you alluded to it just at the end. I'm wondering how the area agencies are interacting with the Attorney General's move to improve the guardianship and conservatorship programs that have been really abused over the years.
Absolutely. Yeah, our executive director for the Area Agency on Aging Association sits on the Attorney General's Elder Abuse Task Force. So we're definitely working hand in hand with them. And we fund legal services as part of our, so we've, like Lakeshore Legal Aid, we provide funding to them to provide specialized services for older adults. So we have an interest in, of course, making sure that system is well-regulated and doing what we all expect it to do, that guardianship should be rare. When they're necessary, the guardian should be well-trained. They should be acting with the individual's best interests, and I think that group has worked in a bipartisan way to create solutions that have had a lot of support. So as their recommendations have come out, they've really been, I think you can characterize them as common sense solutions that everyone would expect guardianship to work in that way, that, you shouldn't have 500 individuals that you're responsible for making every decision for. That's an impossible load. So creating some of those protections, hopefully protect against some of the tragic stories we hear in the news, right? So
Macomb County has some pretty rough stories.
absolutely.
Katie, I have a couple questions. That 9 million for is the Medicaid,
That's the non-Medicaid.
non-Medicaid, for the $9 million, how many people do they expect that to cover?
So
Do you have an idea?
we have a formula we've crafted over the years where we take that 7,000 individuals on the wait list. We get updated data from the state about the cost to serve those individuals, factor in a little bit of inflation in that cost, and then how the funding model works for most of our services. It's federal, state, and local match. So when we grant funds out to local service providers like Macomb Community Action, they're responsible for coming up with like 15% match in local funds. So we factor that in, making the state dollars go further, and arrived at that number. So that's the methodology. So generally looking at that funding with a combination of other sources, hopefully to serve that 7,000. What we've learned in the past, that it doesn't ever go that far. I think the state value on the cost of care for a year is kind of artificially low, oftentimes because people don't stay in the program for the full year. And so we do our best with what we have, but that's how we arrive at that number.
And the people who are in-home, have you been doing that for a while, or is this something new?
The community living program, it's something we've been doing for a long time.
How are you doing with staff for that? How is that doing for the state and staff?
The direct care workforce component is always a struggle. We actually do reimburse a little bit higher for that program than we do the My Choice program, in part because we have some more flexibility with how much we allocate for that. So that helps a little bit with that, but we are also, that's a struggle. More recently, we've even started to struggle as the AAA-1B in hiring nurses and social workers, our RNs and licensed social workers who create the care plans and things like that. That's a newer issue that I think we're starting to see across in-home care service programs. Not at all to the extent that the direct care workforce is the problem, but worth noting.
Can you say what you attribute that to? People just not wanting to work, or danger in going to homes, and a certain percentage of people going to homes or driving areas, even in good areas, it could be a concern. Do you have a?
I think there's such a shortage of nurses right now that people can.
I talked to the Small Business Administration yesterday. It's because of the, back a while ago, the 18 and over population was much higher because families were bigger. The 18 and over population now of the people work is half as much as when we were coming into the workforce.
Yeah.
So there's just not the people. The people are not there. There's more people over 65 than under 65 right now.
Like a hospital system or insurance company may be able to pay more than we can as a nonprofit as well. So
Yes, the person that's got the money is getting the worker.
I would assume there's an intense, I want to say interrogation, for hiring people, but I would assume the interview process, it can't even be that way anymore, is it? If you meet certain guidelines, you're hired, or is it more specific than that?
we have a lot of requirements because we receive Medicaid funding especially, but generally the state funding. So we have really intense background check requirements. That's a barrier for direct care workers. Those are actually increased just a couple of years ago by the state. We run some pretty extensive checks on people so that we can't just take anyone who walks in the door, I suppose, also because of both the quality of care that we hold ourselves to, as well as some of those standards.
I think that is all the questions I have. Everybody's good? Well, Kitty, thank you for coming and giving us all this information. You'll need a nap after this before you drive wherever you're going.
Well, I want to thank you all for this conversation. Really, this is a great group, and we're always happy to come and talk about other things too. It doesn't have to be advocacy, because you all are a great community resource. So I really appreciate your questions and engagement, and please do reach out to me, as a group or individually if you have any questions or concerns. Really enjoy being able to come out here. So thank you for the invitation.
Thank you very much for coming. Thank you. Get back to where we're at here. Start here. Now we're going to the senior volunteer selection. This will be the hardest thing on the agenda, I think. Oh, I'm sorry. Can have a motion to receive and file, please?
Make a motion.
Support.
Thank you. I'm not taking a vote on that then, am I? Okay. All right. All in favor, please?
Aye.
Are there any nays? Thank you. So are we going now to the senior vote? Yeah. How do you do that? And just-
So we'll do a roll call vote for the Senior Volunteer of the Year. The top 4 senior volunteers are in your packet, their nomination form. Each of these volunteers are senior volunteers who volunteer helping out the senior community within Macomb County. So you'll choose just one from the 4 names. I do need 9 for a majority. So if we don't reach 9 in the first round, I'll drop anybody who receives no votes and the lowest score, and then we'll go to another round and keep going until we get a majority. So I'll call each of you by name in alphabetical order. We'll have Chair Zinner go last, and
Good, because I can't even find my person. Okay, here. These are very hard decisions. This is like you want to hand it over to anyone else.
so like I said, I'll call each of you in alphabetical order. You'll just give me one name between Castiglione, Dwemling, and it's 2. It's Bill and
Nancy Dunling?
yeah, Bill and Nancy Dwemling. I'm probably botching all these names. So Castiglione, Dwemling, Gellert, or Triner. So I'll start. Betty Bishop is first. Whenever you're ready.
Gregory.
Gregory is
Gellert.
Gellert. Okay. Rochelle.
Gregory Gellert.
Okay.
Castiglione?
Vito.
Vicky,
Castiglione.
Phil.
Gregory,
Marcia.
Vicky?
Moira.
Gregory Gillert.
Carol Thompson.
Gregory.
Barbara Vansickle.
Gregory.
Carol Weidenbach.
Gregory Gellert.
Roy Wilson.
Triner,
I'm sorry, I didn't hear the name.
Trainer.
Oh, the other one. The other one I can't find, yes.
I
Yes.
think that's the last page. Carol Weisman
Gregory Gellert.
and Chair Zinner.
Gregory Keller.
Okay, so we have 9 actually for Gellert. So Gellert is our Senior Volunteer of the Year.
Good. Yeah.
Yeah, right.
I didn't hear what you said. You had 9 for who?
I'm sorry, for Gregory Gellert.
Gregory Gellert. Thank you. Now we're going to be discussing the Area Agency Senior Action Week regarding the Michigan Day live stream event, May 17th. Yes, Adriana, please.
So this is just to let you all know, again, we're going to host a get-together, if you will, of the live stream event here for anybody who wants to join us. So it's May 17th. It starts at 11. We'll probably do it in one of our rooms over here again like we did, and we'll have a little lunch or something. So anybody who wants to join, please join us. Everybody's welcome. And it goes, I think, 11 to 12, 12:15, something like that. So. And there's a little flyer on here just with the information too about it. So they'll go over the platforms that Katie discussed. So it'll be a lot more on that.
All right. Does anybody have any discussion about that, or are we good to go, or?
It was nice last year doing it that
It
way.
was.
yeah.
Good to come?
It was interesting, yeah.
Good, good, very interesting. I think we will be even more interesting this year.
We all went there the one time.
Yeah.
Yes.
Nothing's gonna beat that.
No.
All right, great, good. All right, I think we need a motion to receive and file.
Make a motion.
Thank you. Oh, sorry. Do I have any yays? Or what do I say? All in favor?
Aye.
Are there any nays? I can't get used to the wording here. So now we're into, is that it? Public president, nothing else? No. Roy had brought up last time about trying to help children read. And I've been investigating that a little bit. I'm taking some steps, and I'm not backing down, but I know a lady who's been teaching children about Christianity in a school for, I think, maybe 20 years, and she's still doing it. But this is, because I don't think we just go in with a book and start reading for children who really can't read. I think we might have to, I mean, I'm thinking about second grade. I don't know why I remember my grade school so well. Maybe because I had to learn a lot. I mean, maybe I was slow, I can't remember. But I remember learning the ABCs and over. The teacher would go over that stuff and over. And I'm thinking, don't we have it already? And I remember just going over the vowels over and over. And I have a friend who has designed a reading program. And she said, what do you mean you learned vowels? What do you mean she worked with you like that? What, the class? And I said, that's just what I remember. She says, children didn't learn vowels back then. And I said, well, we did. And she said, why she designed a program for children? And I said, well, she says, well, you can't have it in a school. And I said, well, maybe we could. I'm thinking positive here. But either way, I mean, baby steps. She said, you might be able to have it in a library. So I'm thinking, if you really want to teach your child to read, they might have to learn letters. They might have to learn sounds. You can't just jump into the pool if you can't swim, although some do. So I'm investigating this more and more. I haven't forgotten about it, Roy, but I just have more to do with it. And anybody else who has to come up with anyone who comes up with any ideas, let me know. But I haven't forgotten about it because we have, it's good to care about our children. We have to care about our children. And there is a great need. Even if it's just for a few children, then we're able to help a few children. It's all good. So I haven't forgotten about it. That's what I want you to know. So we have I just lost it. Hang on. We have a letter of support we would like to send back to the legislature for well, I have that here. I thought that was it. There. See why we just love our staff. From our board, you sent a letter last year, I believe. It's basically a form letter, and we would support and thank you for what you're doing for the needs of our citizens in the state, and of course our county. You have it here on with your form. Thank you for finding it. Out of staff helping you. And have you looked through it, or do you want to walk through the tulips here? It looks very nice. Anything you would like to add to it? I think it's very good when I read it.
Yeah, it's great.
Yeah. Well, that's what they do. And I think it's great. And if you're happy with it, or if there's anything you want to add to it, just. So
I think,
are we all
Katie,
good with it?
I've got a question. Katie, you still want us to do individual, correct? Okay.
Yes.
Collective letter has a lot of impact. I get a copy, I can take it there for all of them.
But you said you were looking for volume too, right?
So could we, is this okay? And we could
Has all of our
just
names
send,
on it.
we could send it, each send a letter, or send 20 letters, or 15, 20, 50 letters, or whatever you want?
I could share the link with everyone. if that would help.
Yeah.
Yeah. Okay,
And
good.
this one has all our names on the bottom as well,
Yeah,
too.
I was going to say, yep, the links are in here.
Good. Do you want signatures with that? It doesn't matter. Okay, there we go. Does anyone have any discussion about this?
I'm just wondering, if you share the link with each of us, then we would sign our own and it would get sent to our legislator? Is that the plan?
For this that is signed by a collective body, I would make sure that every.
Yeah, we'll send it out
Okay.
on your behalf, and I'll share it with Katie as well.
Thank you.
Okay, great. Is there any more discussion? Are we good to go?
If you want to take a motion to.
And what am I saying?
Oh.
You're gonna have to write that down for me.
It's okay, here.
Motion to send the letter of support to the Macomb County delegation.
Support.
Is there a yay? So, I'm sorry. Motion and support? Thank you. Are there? Carol, thank you. Is there all in favor?
Aye.
Are there any nays? Thank you. Thank you all. We are now in public, does anyone have time when they speak?
Oh, yeah, it's right after, I'm sorry.
Okay. We will now go to public participation for anyone in the audience. You'll have 3 minutes to speak and on any topic, if there is anyone to speak. All right, there is no one to speak. Thank you. So we will now go to comments from members. Do we start at one end and go around? How do you? Okay. Is there anyone who would like to speak? Marcia?
Yeah, I have a concern about future meetings. We brought that up the last month. And the next meeting will be the one for older Michiganians Day,
Yes,
that Wednesday.
May.
So then starting in June, do we have a plan or is it still formulating?
I was hoping to have that date for you today. I have a tentative date. I need to talk to Chair Zinner about that, and that's for Harrison Township. We're looking at a Tuesday, it's a Tuesday morning. I just need to go over it with Chair Zinner. So I should be able to send that out
Tentative
to
date.
everyone. June 20th,
And it's a Tuesday
yeah.
morning,
It's
though,
a
not,
Tuesday morning, though, yeah, 10 a.m.
and then going on in the future, Rochelle and I were talking about meeting at the Clinton Township Senior Center, and we just wanted to know more about taking it on the road like you had talked
Yeah,
about.
yeah. So I was working to get June scheduled, which took me longer than I had hoped, unfortunately. And then I should be able to get the next few months lined up for sure. I have at least a handful of places that are wanting to. I just wanted to go in order so I can, June, July, go from there. So I should be able to get that pretty quick now that I have the first date going.
Are we going to meet through the summer?
Yes, unless.
Did you last year?
We
We
missed
had
one
like a
of the
month
month.
off, yeah.
Well, whatever you say. You're the citizens, whatever you want. I did not ask, I'm surprised you did that. I didn't really want to be first, so just because I'm the chair, I didn't want that. But it's hard to get a hold of people sometimes and to see who you can get.
Yeah, right.
And they're accommodating,
Yeah, and
so.
everybody's different schedules.
Yes. Okay, so I just wanted you to know that. I didn't say, hey, get my
No.
city in first. No, I didn't do that. I just want you to know that. And it is, I have traveling on the road. So I do have, I had that on my list, so I'm glad you brought that up. Thank you. And the chairman, again, the chairman wanted us to do our meeting at these facilities. I don't know if there'll be microphones. I guess we'll just be Macomb County people and wing it how we do it, and just have fun and interact as much as we can, and we'll see how it goes. Now, Adriana will be sending out directions, this and that. I'm gonna pick up Betty if you need me to, okay?
Yeah.
And I told her I'd pick her up, so if anyone needs help, or if you're concerned, Harrison Township it's at the end of the road. You just drive toward the beach and there you go. You stop at the water. You can't go past the water. And, but anyways, it's an easy place to get to. And then the other places, I don't even know where some of them are. Yes,
With Clinton Township, ours is gonna have, if we have it, it'll have to be before, probably before 2 o'clock, because our transportation stops at 3 o'clock for, the participants that use, the bus. So we would have to be there probably at 1 o'clock, so in case we go over,
Right, okay.
yes, and some of these people that I've talked to, a couple of them, Adrienne has talked to a couple people of facilities, and they have their morning times, lunchtime. Some places have a larger group in the afternoon, and so it kind of depends on each group and their bus times and the whole slamali. So there are factors, yes. How many do you think, if that scheduled day is going to work for you, do you think that timing, how many here think they can come at 10 o'clock in the morning?
Tuesday?
Yeah, is that a bad time for you? I mean, do people work in the morning at 10 o'clock, or are
We're
you?
retired, Barb.
I'm not.
Well, I think there's a few people here there.
Yeah,
Yeah.
yeah, it depends on when it's scheduled. Some mornings will not work and some will.
Yeah.
For me. But an added question, when we were talking earlier, Rochelle and I, if we were ever to schedule like an 11 to 1 meeting and so on, it's possible to get a lot of the members to come in if there's a lunch. And I don't know if the board ever buys a lunch, or we would, through the senior center, get a sponsor to provide sandwiches or something like that. Then we get pretty good turnout
Oh, yes.
for people that will understand more about what we're about.
Well, I think they're planning to have when their people are going to be there, whether it be for, there are times when people will expect to be at their centers. That's what they're,
Probably help get sponsors for lunch.
oh, well, yeah.
And people will come for free food,
Yes, they
trust
will.
me, trust me.
God bless you for
You'll
still
see
working.
people that you never see at other activities when you offer free food.
Well, that's a very, well, there you go.
Works.
Yeah. So probably as soon as we
I know,
know the
everyone, all right, so
dates,
we have to have
even
adjournment,
more
people
than
have
a
schedules here.
place, once we know the dates, we
Right.
can mark.
Okay.
Does someone want to make a motion to adjourn? And we can,
Make a motion?
Carol and Lori support. All in favor?
Aye.
Are there any nays? Thank you all very much.